Oh, hello. How you doing tonight, Georgina?
Good, good, Dr. Murray.
Awesome. Well, tonight we get to talk about the exciting topic of parasites. And parasites are so pandemic. It's unbelievable. It's an amazing thing. I have patients uh, every day that when I'm going through and I do an analysis on them, and I got to give them the news that they have a parasite. They are blown away because it seems to be the enemy within, something they didn't even know they had, and it's pretty incredible. And I know that in America we tend to not think that that's possible. Okay, but it is. Now you originally are from Mexico, right?
Yes, I born in Mexico, yes.
Born in Mexico, so you have the most incredible parasite story. Okay, do you want to share that with us?
Yeah, well, actually, I was like around 6 years old, and yeah, I mean, I have the worm, the ringworm. Okay, so I've been always very thin, so, but I used to have a very distinct belly. I don't know, but when you have worms, you can get a big belly, but you can be like this big, like a very, very, very tiny.
Mm-hmm.
So I remember my mom gave me something. I know they give me raw pumpkin seed with a epazote. That's like a sea worm. That's what they call it. It's a plant, a herb. So what they did, she mixed it up with a little bit of water and give it to me. So I ate it, and the next day they were coming out like a bunch of it. It was coming out from
Wow.
my nose, from my mouth, and from my butt in the same time. So my mom, out of my tiny body, she grabbed a jar. They used to have the cookie jars. You remember the ones that they used to come in like that, and they used to have the little cover.
Right, right.
Those jars, she filled it up the entire jar, the entire jar out of myself. So, but a lot of people don't understand that something that drastic can also kill you. I almost died after that
Yeah.
because
Oh,
it's not
you mean
because
after you
after they
lost all
got,
those
yes,
parasites?
they told my
Hmm.
parents that maybe I'm gonna live like probably maybe 2 hours. They
Oh,
told me,
wow.
yeah,
Wow.
because the thing is, after the fact, what it was happening, I was like fainting and fainting and fainting and fainting and fainting and fainting and fainting. And it was just because my body was a big shock after the fact.
Wow.
So um, my parents, they took me to the hospital like normal parents do. They
Hmm.
took me to the hospital, and what they tell them that they can do nothing, that they didn't know what to do. And then they go like, we're gonna keep her here in observation. That was all. So my parents, out of frustration, they say, what about you switch her to another hospital? And I said, well, the next one, maybe it's going to be 2 hours away. So do you want that your daughter die in the way to the hospital, or go take your daughter to your house and let her die, with her stuff and her house and everything else? So my parents, they took me back to my house,
Wow.
waiting for me to
Wow.
die. My older sister, she always said, tell me that I'm a bad weed. You say bad weed,
The one you just cut that just wouldn't die. Oh my
yeah,
goodness,
you
that's
say bad
incredible.
weed. She said you're a bad weed because you never died. Because also, it's a lot of things that happen. I don't know why I'm even here that far, but it's
Hmm.
happened so many things. And one of those things was parasites. I almost died out of
Wow.
parasites. But also too, another time I got a uh, a scorpion.
Wow.
The scorpions that where I'm from are very venomous. They're like tiny ones, and they're like a clear brownish,
Hmm.
and those are very bad. They're very deadly. And people
Hmm.
die with that. And I got a stain like a centimeter
Hmm.
out of the main artery. So
Wow.
they were thinking they didn't done anything in the hospital. They were just looking at me like, and I was there. And my sister, that's why she always say, "You're a bad weed. you have to be a bad weed."
Well, that is an incredible. That is
Yeah, so
incredible.
it is interesting. But parasites is something very serious. Something
Oh
serious that
yeah.
everybody don't understand
Hmm.
the seriousness. It was this doctor at one point that we're talking about cancer. And they say that when you have parasites, it relates with cancer.
Right. Hold the
And I
card.
believe it because, besides robbing you, the nutrients that you have, on top of it, the toxins that they produce inside your body that you keep in it there, so that you cannot get rid of it. So I think that a lot of people, they don't really understand this, the serious of being with parasites, having parasites. And a lot of people here in the United States, it seems like you're talking like out of like something really rare, which is
Right.
not true. So
Right.
what do you think? What is? How do you know that you're prone to have parasites, Dr. Murray? Do you know what are the?
Well,
I mean,
you know what? When I'm talking to my patients, certainly one of the questions I ask them is, "Have you been traveling internationally?" Because that's really one stop. That's one place that they're going to pick up. They're going to pick this up. I have a lot of patients that are missionaries, and so they
mhm,
come back, and there's always something to deal with. Now, a couple things about that. There are parasites. There are parasites that you get, and you're the only one that gets them. There are parasites also that you get, and that if you want to call it contagious, that they can be things that are spread in a variety of ways. And so that's also a question. Have you been traveling? Has anybody in your family or household been traveling? These things are really important. Then also, oh, go ahead.
yeah, the traveling part is very important because a lot of people also to bring weird parasites that they don't have it here for real.
Right,
Hmm.
right, right. And so these are questions that I'm always asking, and then looking at the environment that they live in. Whether you're rural or urban, you have your own parasites. Every area has the parasites that really kind of exist there. Most of the time, what's really crazy about parasites, if I get let's say I pick up the virus, right? The C virus everybody's talking about. You get some symptoms, you kind of actually about 80% of the time you don't even know, you can be asymptomatic, all right? Parasites, that number's way higher than that until way down the line. Okay,
Yeah,
you can have things that are manifesting and growing and doing all kinds of things. And when you don't know you have them until you start to clear them or do something to clear them, and then you see this. And I've had this recently with we do some fertility work. Okay, and this is one of the ways the parasites can affect you in fertility work. I had a woman that we did a detox with, and we did a parasite cleanse with, and she called, and she's like terrified about what's coming out of her. All right. And actually it was so revolutionary in her life, as far as her cycles and all these other things, that it was having that effect on her. But when they were coming out, boy, man, it was an awakening. And this is really the way parasites can be, right? They can be, you know,
yeah. But the thing is, a lot of people don't realize that this is something that they have to keep doing it every other year at least. Same thing
right,
with detoxification. Parasites has to be removed every other year for the sake of everybody. Because if you have pets, you live with pets, most likely you have parasites. If you
right,
walk, if you hike, a lot of people go for a hiking, you have
right,
parasites. If you
right.
swim, go to swimming, like swimming pool, public swimming pools,
Oh yeah,
um, like the lake here. Now that
right,
I have my lake here. So, but also too, if you go like to the park only, it's a lot of stuff that we do that we get parasites. Now, if one person bring it to the house, maybe you don't do it, but somebody that you live with, your kids, your husband, your wife, whatever, do it. Did you know that you can sit down and they can leave the eggs of the parasite right where you sit down? So how many times
right.
we go places and sit down and stuff? That's why parasite is very easy to propagate,
Right.
to
To
replicate,
spread, propagate. Yeah.
spread it, right? So that's the thing. But also too, a lot of people don't realize it too about the chronic diseases you're talking about. It's related with a lot of chronic diseases. So, and also, I don't know about you, but most people that when they get something to remove parasites, they get something out of it.
Hmm. Oh yeah. Oh yeah. Yeah. Rarely. Yeah. Yeah. It is not normal, or it's not common. Should say that when we're doing a parasite cleanse, I don't remember. I can't remember really. I would say the last time, but I don't remember ever anybody going, "Yeah, I got nothing. There was nothing." It's always something, and I've seen I've seen us do parasite cleanse. One gal, she was a missionary. She had a pretty broad spectrum set of issues when she came back, but she has some intestinal things. We did a parasite cleanse with her, and it was pretty intense. And I'm thinking we're a lot of GI stuff, a lot of this gastrointestinal. She started having worms coming out of, you know how you're talking about coming out of your nose? Okay,
Yeah.
like that, but they're coming out of her eyes and her ears. And it was
Oh,
just, I mean, and for months they were coming out. So it was really
very.
like, you know, where she would come in and she would go, watch this, and she'd pull a parasite out of her eye that was, you know, 2 or 3 inches long, and it was just incredible. So yeah, it's like that.
Well, no, that's kind of gross. I don't
It
think
was
it's,
just
I'm never to
amazing.
get it out of my eyes. Oh my
Oh,
gosh.
oh
Thank
yeah,
you, but no thank you, right?
right, right. Yeah,
Yeah,
so
but parasites, they also, sometimes people do testing in parasites and they come back negative. But you know that sometimes, even if they come back negative, maybe it's a good chance that you have parasites.
yeah, oh
That's
yeah,
very typical. I mean, it's so many people that don't understand that. They, even though you have a negative test, you still are, the chance of you getting parasites out of you is a big one. Because also too, when you were talking about it coming out of the eyes, out of the ear, when they're hidden in the muscles, sometimes you do the test and they don't come out positive. You're gonna get a negative. You know
right.
that? And even though you still have that. So I think that
Mhm.
when people have a chronic disease, I think that removing parasites, it is a very wise idea to just go
Right.
ahead and remove the parasites and get it over with. Mm-hmm.
Yeah, yeah, yeah. So I do a lot with cancer too. I know you had made reference to that earlier. Hulda Clark wrote a book called uh, Cure for All Cancers, and it had a lot to do with parasites. She was connecting the dots between different types of cancers and parasites. And I thought that, and it's really interesting because, you know, we're never treating cancer in our practice because, you know, you go to jail for doing that stuff. But I have cancer patients who we support, okay, and we're going to support them, you know, during this difficult time in their life and giving them strategies and helping them. Well, always one of the things that we're looking at is parasites. We're looking at, you know, different things in their diet that they can be doing, different strategies that they can be doing, that making sure that they're not inconsistent with any therapeutic that they might be doing, that their regular physician is doing. Okay, but certainly whether they're doing anything or not with that physician, there's things that they can be doing, and one of them is dealing with parasites. Okay, different types of parasite cleanses. Okay, and different levels of parasite cleanses.
Mm-hmm.
So, and sometimes you know you got to be careful with that, but
Well,
but
actually, what you're saying about getting cancer patients with parasite removal, I think that's very important. It's several people that they relate cancer with parasites for whatever reason. I will
mhm,
go with parasites and toxin removal too, because toxins a lot to do with those two things. So
yeah,
I think that's good. So besides, what kind of parasites did you ever see with your patients? Do you know what, Robert?
yeah, yeah. I mean, we've seen tapeworms, pretty long tapeworms. I was telling you about the different type of worm that was coming out of this person's eyes. You know, we've
What kind
seen.
of worm was that one? Did you know?
You know what? Let me tell you something. I sent that off. So I called the CDC on that and said, hey, listen, I took pictures. I sent them a lot of stuff, and they said they were very interested in learning about this. Please send us samples. So I sent them. They had some containers they sent to me. I loaded them up and sent them off. And that was probably, you know, so I probably did that 2 years ago, and I never heard back from them. Okay.
Mm,
And so which is unfortunate. So I don't know exactly what it was. They said we're not familiar with this. That's why they sent me stuff to kind of get some samples and send it off to them. But I
mhm.
never heard back from them. So I don't know. I can't say exactly what that was, but I know she was a missionary in Guatemala, and
Oh,
so yeah, yeah, and so we had looked at a lot of video when she was down there, some photos and videos, and there's a
mhm.
picture of there's a video she showed me of standing in her little hut, and her hut if you imagine, is really just 4 tin walls, right?
Mhm.
With a little pseudo sink in there. It looks like kind of a sink. And then there's a kind of like the V, the way the open gable comes to the end, that was all open. And there's dust rolling in. And she goes, you see that white particulate stuff coming in? I said, yeah, that's probably just dust from out in the road. She goes, no, she said that's fecal dust. And she was talking about this is what because of where they were missionaries, this is what she was in the midst of for 5 years. And so this thing is, that dust had to be loaded with stuff, which is why she's breathing it in. She's ingesting it. It shows up in her eyes, shows up in her ears. Yeah.
Did you ever heard that a lot of gross stuff goes to our mouth when we open it? Did you ever heard that?
That,
Like
oh, that a lot of what goes there?
a lot of toxins they go through your mouth when you open it, when you
Yeah,
talk, when you sleep. Maybe you open your mouth and stuff like that. Right
right.
now that you say that, I kind of like, oh my God, that's true, probably. So maybe we're gonna put a tape in their mouth, right?
Yeah, no, I think there's truth to that. And
Because it's
yeah,
a therapy. I don't know, but they talking about the stuff that goes to your mouth, the toxins that they go to your mouth when you talk and open the mouth. They go a lot of gross stuff, right? So it's a therapy with a hydroperoxide
oh,
and
yeah,
water.
yeah, 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 yeah. We've used that. So a lot of my patients. So we're using a ventilator, or not a
Uh,
ventilator. No, it's a
nebulizer, nebulizer.
nebulizer. Yeah, we're using a
Mhm.
nebulizer. So we have the nebulizer. We have them nebulizing. It's a teaspoon of hydrogen peroxide, and then you've got it has a container that is putting water in there too. It's mixing the two,
Mhm.
and then you're doing this. And so yeah, definitely that is one of the treatments. In fact, I had somebody that was having some lung issues, but they also had some lower GI issues. We nebulized for the lungs, and the GI stuff got better too. So her ingesting that carried through her system, and really relieved a lot of this lower GI issue, which is really pretty interesting because it's pretty far down the line, but
Yeah.
it still was effective. So yeah, it's interesting. Yeah, that's right. You're right on the mark with that.
If we're gonna tell few symptoms, we have a chart that we can give it away. If anybody looking for that, they can reach out to us. They can reach out to us privately, and we can go ahead and give it to them. Now, let me ask you something. What is the symptoms that people think that maybe they having parasites? Some of the symptoms that people experience based on your experience.
Yeah. Why? So what kind of symptoms are they getting with a
Mhm.
parasite? Yeah. Like I said, a lot of times they don't get symptoms till way later. I mean, you could get something as simple as a headache, or a lot of, like,
All
we
right.
get.
Mhm.
Yeah, yeah, yeah. We get that. We would get GI distress. That's pretty common. Most people know that. They always say, "Oh, I got food poisoning," or "It must have been a bug in there, and I got this." A lot of the people that come back from having been missionaries, their complaints usually are GI as a portal of entry for them. And so we see a lot of things like that. But you can have skin rashes, you can have headaches, you can have sinus issues, lung issues. Pick your flavor. They're there. I mean, what kind of things have you seen?
I see most of the time when they have itchy nose, itchy anus. After that they eat, they get a painful stomach, distended stomach, like a inflammation after that they eat. Um, what else? What else? Basically, mainly GI discomfort. Like a lot of fuel gases and stuff like that.
Right.
So those are very common. Yeah, but one of the things that I have this was my client when I used to do mortgages.
Hmm.
It was very young. He was like probably like 24, 25. They were buying a house with me, and then all of a sudden they disappear. So and these two kids, they were very ambitious. They were very good couple. And then one thing they surprised me that they just out of the sudden they just don't keep following with me. So she disappeared and he disappeared. So and then like a month later, she come back and I say, hey, listen, you're gonna lose your money from the earnings money. You're not doing anything. she called me because I was calling them and they never reach out to me. So they called me out of the sudden and they say, you got to do something, that way you can get your money. And she goes, oh, well, the thing is my husband is in the hospital. And I was like, huh?
Wow.
Yeah, and I said, why? He said that one day, this is a very young guy, okay? He went to the store just to buy something, groceries there because she was cooking and he never got back. He just disappeared. Now, she thought that maybe something happened to him, maybe, an accident or something, because they used to get along really good and stuff. So anyways, she started looking for him. He called the police and everything. What happened to this kid is that he went to the grocery store and over there, he just didn't know who he was. He lost consciousness and he
Oh
just
yeah.
started wandering by himself. And you know what it was the cause? The tenasolium egg in the brain.
Mm-hmm. Yeah.
So it's very common to hear those kind of things especially from Mexico. It's very common that kind of stuff. But when I saw that kid, it was, and after the kid, they have to literally get surgery in the brain. And after that, he was not very well put together anymore.
Wow.
From being so healthy, young kid, like that, he used to do exercise and everything, then to go to the other side of the coin, just for
Right.
parasite. So the brain, I mean, he ended up having, I don't know if now he improved, but he was like some sort of he was taking too long to process things after the fact, and he wasn't very bad shape. And it was due to the egg of the parasite. Because some
Wow.
of them, they go to the brain barrier. I don't know if you know that. But it's super common, especially that parasite, to go into the brain.
Mm-hmm. And and which parasite did you name? Amoeba?
Tenasolium, the solium, tenasolium.
Tinea? Okay.
Mm-hmm.
Okay. Yeah.
The tapeworm. I mean, you call it tapeworm, right?
Right. Right.
Mm-hmm.
Yeah. That's interesting because each of them have their predilection or the area that they like, okay, or that they can most affect or commonly affect, but and their life cycles are different, Some are the life cycle of each one of these is different or can be
Well,
different.
did you know that particular tapeworm in particular, it can grow up to 20 feet, 20 meters, I'm sorry, 20 meters.
Right.
And I know that a lot of people, when they go, they walking or doing whatever, anything, normal stuff, and that thing is coming like a little bit thin of stuff. They're just coming out of your butt.
Right.
Just like that. And because I heard that a lot. They say that when they are just doing like random stuff, that thing is coming out like a little pieces of it. Now, what is staying there is the head, because I don't know if you know, but the head has like a crown of needles. That's why it's so difficult to get rid of it. So it's a crown of needles, and what they do in the membrane of the lining of the stomach, those needles go and they go inside, like they penetrate the lining of the stomach. That way, the head never loses. So what it does is the tail, the part of the tail, that's the little thing that people experience in the underwear, and it's just like moving there, like like spaghetti, something like that is moving there. So it's like, and people say, I heard that a lot. But yeah, the head of the tapeworm is very difficult to get rid of it. It's very difficult. So I don't know, back in the 70s, some doctors they used to give this particular egg to people that they want to lose weight.
Oh yeah.
So they
Yeah.
used to give it to them, and then people, they used to lose weight because parasites, they eat your food and stuff, and then afterwards they did something to remove that. But I think that's when I tell people that they go into way too much. You know what I mean? They have to start doing things the right way. When they try to cut corners, they're gonna get some bad things
Oh
coming
yeah,
out.
totally. Yeah, totally. I mean, that's one of the things about, when you're giving yourself a parasite that's so effective at what it does, it malnourishes you essentially. You're malnourished. Your body is probably running a low grade immune response to this thing. There's a lot of other things that are going on, and you're doing that to lose weight, to try to get healthy by something that is anything but healthy for you. And you're right. Anytime you try to cut corners, you're going to pay the piper. It's tough. I see that all the time.
Yeah, same thing here. So, well, it's almost about 5 minutes in. What would
Okay.
be your advice for somebody I mean, if somebody is struggling for a chronic disease, do you recommend it to remove parasites or no?
Oh, absolutely. Oh, totally. I think that if you remember your experience when you said, "Hey, listen, my parents were just they gave me this stuff. The parasites came out. They took me to the hospital because things were so bad, and they said just go home and die." These are serious things. I think it's really important that first of all, you do some things to try to figure out whether a parasite is something you should be concerned with. How is it manifesting in ways that you don't know? An assessment a lot of times can help with that. And then when you do something about it, that I personally, I see a lot of patients, my family, my friends. It's like you need to be coached a lot of times in these things because they can have a serious downside. I mean, they can cause some serious problems, depending upon what type it is and how significant it is too. So, what kind of things would you recommend?
Well, I recommend to remove parasites regardless every other year. So I have done several parasite cleanse before in my entire life. That's one of the things I do. I'm not really good at following every year but every 2 years, every 3 years, I do it sometimes. You know what I mean? I do it like a normal thing. But also too, I do other stuff. Like for instance, sometimes during the year, I get like 5 days straight to get coconut water, empty stomach, and as soon as I get up from bed. So that's very common on me. And I do it because coconut water is very good for parasite removal.
Mhm.
Okay,
Right,
empty stomach. All right. So some other times what I do, I get garlic, empty stomach, like 5 days, because certain parasites they're not gonna do good with coconut water, but certain parasites they're not gonna care about coconut
right,
water. But the garlic, certain parasites they don't like it, so I do it empty stomach as well, and
right.
also to papaya seed. Papaya seed is very good for
Mhm.
parasites. So that's what I tell people to do sometimes. But
Right,
also too, if I see this a chronic patient, you have to go ahead and do a real treatment, like a serious treatment with
right,
serious things and take it a
right.
little bit more
Hey, on
serious
the
about it.
garlic, do you recommend doing, on that garlic, do you recommend doing a black garlic, which is that fermented garlic? Do you like that at all for this?
No, I just get raw garlic, the
Okay,
normal raw garlic,
so,
just raw garlic and chop
okay.
it. And I
Mhm.
honestly, I get it as smaller as I can, but I just swallow it because I don't like the taste. Like I don't
Oh,
like
you
chewing
swallow,
it.
oh my goodness.
No,
Yeah,
I
you
don't like
swallow it.
chewing it.
You swallow
Okay.
an entire whole clove. Oh, you're
Yeah,
my
I just
hero.
swallow the pieces. I can swallow. That's it.
Oh,
That's it. That's all I'm gonna do.
wow.
Okay.
Yeah.
But the papaya seeds are super good for parasites as well. I mean,
Okay,
if you
great.
get like you get a papaya, you get a little spoon, and you can eat one a spoonful, or
Mhm.
maybe 5, 6 seeds. And actually, I don't know, but it's certain treatments with papaya seed. They are very good for the GI tract because
Nice.
papaya has an enzyme that no other
Yes.
plant has it. So,
Papain, right. Yeah, yeah, there's digestive
but the
enzymes in
seeds
there.
in particular are good for parasites.
Nice.
The seeds, coconut water, but you see, the thing is, this is what I get with people. I say coconut water, and they go and buy the carton. No, real coconut water. Okay, you see, it's not a carton. All right, can you hear me?
I got you now. Yep.
All right. So real coconut water, from coconuts, not like carton anything, okay? Because I don't like that part of it. All right. So, and actually, it's not gonna do good if you don't do it the right way. All right. And the garlic, just raw garlic. Actually, raw garlic is very good for you and a lot of, for a lot of
Yeah.
stuff. So if you get used to use it every single day, at least once a year, get a raw garlic, empty stomach for 5 days, and that's it. And
Wow,
that's for
that's
some type
fantastic.
of parasites, okay, not all
Yeah.
of them.
Yeah,
Mhm.
yeah. Well, fantastic. Well, this has been good. I think that these are things that people, really would benefit from paying attention to. I think it's things that, yeah, again, I like to have some sort of schedule that I'm doing this, or if you've never done this, that you're wondering whether it would be something you would do. I think an assessment sometimes is really good for that. Or getting in touch with somebody that can help you with that. That can do it too. So, and again, being safe. I'm always on the side of being safe. So, mhm.
Yeah, and next time what we're gonna be talking about, Dr. Murray? You wanna talk about heavy metal
Yeah,
toxicity?
I was going to say heavy metals, because heavy metals, we alluded to it earlier. Heavy metals actually pair with parasites very well. I've heard it say if you have a parasite, you have a heavy metal, and vice versa. And in my testing, we see that a lot. We see a very high correlation between that. So yeah,
Oh,
absolutely,
okay.
we'll be doing heavy metals,
All
and
right, so
okay.
great. All right, so maybe until next time, thank you very much, Dr. Murray. So
Yes,
we
and
see
thank
you.
you.
All
Awesome.
right, see
All
you.
right, have a good
Bye,
night now. Okay.
everyone. Bye.
All right, peace.